Welcome to Dental Business RX. Practice success in 30 minutes or less.
Thank you for calling ABC Dental.
For a general dentist, we all know that building a strong hygiene department is not only desirable, but important. But if that's the case, why is this such a problem? For that matter, I'd rank an underperforming hygiene department amongst the two leading weaknesses that dentists have in their business model, the other being case acceptance. So again, we know that the average doctor wants a great hygiene department. It can be a wonderful profit center, and more importantly, it's vital to achieving your practice's purpose. If your purpose is to restore health, function, and aesthetic and maintain it for your patients, you're going to have a hard time doing this if you're not seeing them regularly. When are you going to find the small problems before they become big ones? This is, again, why we need a hygiene department. It's a needed and wanted. And again, despite this, it's still an area that seriously underperforms. And that's what I want to talk about in this week's episode and next week's episode of Dental Business RX. Yes, this is a two-part episode. Specifically, I want to cover why hygiene departments underperform, and more importantly, the steps you can take to fix it. Again, it's a two-part episode. It's pretty involved, and I couldn't cover it in one. So again, this is part one. My name is Jeff Bloomberg, and I'm your host. And let's start with what I found to be the two major reasons hygiene departments underperform. They're actually pretty simple. The first reason is the doctor or the office manager doesn't realize that the department is actually underperforming. They think it's going pretty good. And number two is they may realize that it's underperforming, but they don't really know what to do to fix it. So I'm going to start by taking a look at reason one, because if you're going to start trying to fix your hygiene department, you first have to find out, what condition is it actually in, right? Is it underperforming? And you may not think that it is. It might be busy. You have a nice perio program going. You have very few cancellations and no-shows. Maybe you have 5 or 6 days of hygiene. You have 2 great hygienists that you're very happy with. You're producing at a satisfactory level in your mind. And that's great. But this is really a case where you're missing the forest through the trees. Production or hygiene revenue is a side benefit of your hygiene department. The way you tell if your hygiene department is actually working is if it is constantly growing, because then that means you are retaining patients. All right, this is critical. Is your hygiene department constantly growing? And you have to differentiate when you look at whether your department's growing or not in not just revenues, because there's lots of places revenues can come from to build your hygiene department. You could be getting, you have a very productive perio program, or you're seeing a lot of new patients in hygiene, but that doesn't tell you how many patients are staying active on recall. That's the real number we want to look at to see how healthy your hygiene department is. Let me give you an example. So if you're an average practice adding 30 new patients a month, which is a lot of practices do more than that, some do less, but most do more. That's a pretty average number, 30 new patients a month. If you're adding 30 new patients a month or 360 new patients to your practice a year, and you have decent retention, you're retaining 80% of these. This is not a really complex scenario I'm giving you, and I apologize for the math, but I know it can be tough if you're listening to this in the car. But I'll keep it simple, and this is just something you got to think with. So again, 30 new patients a month, 360 a year, and you're retaining 80% of them. So that means you're retaining 288 patients in the practice. If you're doing that, you take 288 patients that you added to the practice in the last year, and you multiply that by 2. That's 576 hygiene visits, at least, assuming each of these patients at least need 2 recalls a year. Some may need 3 or 4. So you've added 288 patients. That's 576 recall visits. Let's say your practice is open 50 weeks a year. You take 2 weeks a year off, and you added these 576 hygiene visits. Well, then you added an average of 11 and a half hygiene visits a week, recall visits. Again, to be specific, we're talking about recall. You added 11 and a half a week. If a hygienist sees 8 patients a day, you effectively, with those 30 new patients a month and 80% retention, added 1.4 days of hygiene a week in the last year. All right, 1.4 days of hygiene. So if you had 4 days of hygiene last year and you do this, a year later, you should have about 5.5 days of hygiene. You play this forward 5 years, you would have added 7.2 days of hygiene a week to the 4 you already had. So you'd have 11.2 days of hygiene just in recall. Now let's look at the average office's average hygiene schedule. If you had 4 days of recall before and you added 11.2 days of recall, that's not just 11.2 days of hygiene a week, because especially if your hygienist is seeing new patients for new patient initials, of course you're doing the initial, but they're maybe doing the perio probing and full mouse, and maybe they're seeing you have a perio program going. They're doing scaling and root planings. So on top of those 11.2 days of recall, you have all those other patients. So you're really looking at an office with 14, maybe 15 days of hygiene. Well, that's, 3 or 4 hygienists. So if this office is open 4 days a week, right, you've got a situation where you got 3 or 4 hygienists. You probably need an associate only on 30 new patients a month. So think with those numbers for a minute, because I'm using very average numbers. And based on what I've seen, this is not what I normally see. Normally I see an office with these kind of numbers struggling to keep 4 days full, and that's including new patients and perio. So the first thing you want to do if you're going to take the first step into building your hygiene department is you want to do a thorough but simple evaluation of exactly what's going on in your office. Now, I recommend that you use something. We have a little formula called the Hygiene formula. I have a spreadsheet for it that you can apply to your office. It's very easy to use. You just fill in 3 blanks and it gives you some numbers. And I'm going to walk you through it real quick because it gives you an idea of what's actually going on in your practice. So here's the hygiene formula. It's got 7 different steps, and then it spits out all your numbers. You just have to enter numbers for 3 of them. So the first thing you'd enter is you would take a look at the total charts you've seen in the last 5 years, total individual patients you've seen in the last 5 years. Now, you might say, Jeff, why am I looking at the last 5 years? Well, the idea, and I've talked about this in other episodes, the idea of a quote-unquote active patient is a completely arbitrary definition. I'm sure you've had patients come in that you haven't seen in 3 or 4 years. They come in and you go, wow, it's been 3 or 4 years since we've seen you, Bill. And they go, wow, has it been that long? They always considered you their dentist. This idea of 2 years for a person to be an active patient is primarily used in practice sales. It's a broker definition, because if you're buying a practice and you want an active patient count, they're going to give you who's been in there in the last 2 years. That doesn't mean the people who are there, not there 3 years, 4 years, or whatever, don't consider themselves patients of the practice. And these patients, for the most part, are all recoverable. But for our hygiene formula, the first number we want is total charts for the last 5 years. So we take that number, and I've got some sample numbers that I'll give you for the formula so you can kind of think with it. Again, I apologize for all the math, but it's not that difficult to think with. So let's say we have a practice that's seen 4,000 patients for the last 5 years. This is not unusual. This is a common number we see. All right, so you take that number 4,000 and we multiply it by 2, right? Because 4,000 patients, 4,000 unique individual patients would be 2 recalls, right? Okay, then we get the number 8,000. So now we're going to subtract some patients for attrition. If you're the average office, you're probably not spending a lot of effort on retaining patients. A lot of effort is spent getting new patients in, and very little effort is spent keeping patients active in the practice. Now, if you do have good retention efforts in place, I wouldn't expect you to lose a large percentage of your patients. I would not want to see that number above 20%. But let's say, since we're going back 5 years, the number we use here in the hygiene formula is 40%. So we're going to subtract 40% from the number we just came up with. So we had 4,000 patients times 2 recalls is 8,000. And we're going to subtract 40% from this number, which is 3,200. That's a lot. That's a big factor of safety. It's very conservative. All right, so what that leaves us with on point 4 is our potential number of recall appointments per year out of those 4,000 charts. That number is 4,800. So again, I'll throw that math out to you. If I have 4,000 people who have been in the practice in the last 5 years, and I lose 40%, 4 out of 10, 2 out of 5 of these patients, I still potentially have 4,800 recall patients per year. And obviously, again, we're being conservative because some of these patients are coming in 3 times and 4 times. We're only accounting for 2. So then I would look at how many weeks the practice is open per year. Let's pick an average. Let's say the office is shut down for 2 weeks a year. It's open for 50 weeks. So we take our 4,800 potential recalls. We divide that by 50 weeks we're open per year. That gives us 96 potential weekly recall appointments. So you get this. 4,000 charts, subtract the 40%. We're open 50 weeks. That's 96 potential hygiene visits, recall visits per week. Now, the average hygienist, and this is adult profis for the most part, you'd think, the average, unless you're a pedodontist, the average hygienist is going to see, let's say, 8 patients a day. So if you divide 96 by 8, that's 12 days of hygiene. So that's the potential number of days this practice has of hygiene, accounting for losing 40% of these patients. All right, so now once you've done these numbers for your practice, this is your potential. What should we be doing? You now want to take a look at how does that compare to what we are actually doing. So now we're going to enter a couple other numbers. We're going to enter our total recall appointments for the last 4 months. Now, again, just to be clear, for recall, we're counting 3-month, 4-month, perio maintenance included, 3-month, 4-month, and 6-month recalls. So we count up how many of those we've had in the last 4 months. And let's say this practice does this, and I'm using real numbers from a newer client that we did before to give you an idea. And this number was 510. All right, 510 recall appointments the last 4 months. Again, this wasn't total hygiene visits because they also saw perio appointments and new patients, but recalls. So the average recalls per year would be 1,530. The spreadsheet will give this to you. And your average recalls per week, on this example I'm giving you, are 31. So now, we had 96 potential, but we're seeing an average of 31. So what that means, if we divide 31 by 96, which the spreadsheet does for you, our hygiene program compliance percentage is 31.88%. It's less than a third. That's our hygiene compliance. So now you could see how someone could look at, again, our hygienist is busy, our hygiene production's higher than a lot of my friends and colleagues, we have 4 to 5 days of hygiene, we're happy, okay, fine. But potentially, you don't even know, you could be doing 3 to 4 times that. And as long as the hygienist isn't sharpening instruments or sitting with no patient because you're paying them $50 to $60 an hour, you're happy. Doesn't matter who they're seeing. This is where, again, we miss the forest through the trees. And if we take a look at how this plays out, this little formula I gave you, where you had an office that is doing about 31 recalls a week, which this tells you, and I'll be getting into this next week, you should be keeping a statistic for this because this is your growth stat. You have an office that's seeing 31 recalls a week when they potentially should be seeing 96. How does that break down as far as numbers go, fees and revenues, right? I said earlier that revenues are a side benefit, and it's true. Obviously, the area has to make revenue, but this can be a profit center for your practice. So what I did is, using this example from the hygiene formula I just gave you, I pulled some fees together. And what I wanted to do, so no one could say these fees were too high or whatever, is I picked an area that is ranked in the top 20 or bottom 25 least expensive places to live in the United States, Oklahoma City. It's in the top, or I guess top 25 lowest priced places to live, Oklahoma City. So what I did is I looked at a specific zip code in some of the Oklahoma City suburbs, and I took a look at what the average fees were, sample fees, for 3 procedures that are normally done at a recall appointment. So we have, what are the 3 average procedures you're going to have in your run-of-the-mill recall? Is going to be a periodic oral exam, 4 bite wings, and a prophy. Right? Now, I know, and I accounted for this, in some cases, insurance will only pay for bite wings once a year and an exam once a year. So if you have a patient coming in twice a year, one of the visits might be, bite wings, exam, and prophy, and the other visit might be a prophy. And just a quick comment on that. If you, in your practice, feel like you need, again, I'm not a doctor. I can't give you advice or an opinion clinically. All I can tell you is, if you as the doctor feel that you need to do an exam twice a year, just to meet your clinical standard, or if you as a doctor feel like you want bite wings twice a year, this is what you need to meet your standard of care. And you're not doing that because insurance is only going to pay for it once. That's a problem. Then at that point, you're working for the insurance company. And that's something that you have to break yourself of, because as the doctor, your job is to get patients well, and you have to do that the way that you know best. So it's just something to think with on the subject of insurance. You don't want to put yourself in a situation where you're doing what the insurance says because it's the path of least resistance. You have to do what's best for your patient. Anyway, I'll get off that soapbox. But so For these numbers here, I took these numbers from our hygiene formula, and I'm doing it where, we're doing a basic recall visit half the time for, with those 3 procedures, and a real simple one with just a prophy for the other half the time. And the average fees for this area in Oklahoma City that I picked, because I'm going to give you some real-time numbers. The exam average fee in this area is $58.50. 4 bite wings is $68.50. And a prophy, 1110 adult prophy is $99 or roughly $226 per patient. So half the time the visit would be $226 and the other half the time be a prophy only, so it'd be $99. So now let's use these numbers I brought up earlier with this hygiene formula. This office is doing 31 recalls a week, right? 31 recalls a week, or about 130 recalls per month. Half with bite wings and an exam and half without, all right? So on average, this practice sees about 16.25 days of recall per month. It's open 17 days a month, so we probably have, 1.5 hygienists. One hygienist is almost seeing a lot of the recalls, and then between the 1.5 hygienists, with the 17 days that the office is open, we're getting in the new patients and the perio. All right, so the revenue estimate for this 31 recalls a week or 130 a month at these average fees I just gave you from Oklahoma City is $21,775 a month, or about $261,000 a year, just from recall. So an office, again, could look at these numbers, because then you'd throw the perio revenues and the new patient revenues on top of that and think, oh, we're doing over $300 a year in hygiene. We're doing pretty good. All right. But they're not. Let's take a look at what would happen if this office actually reached its hygiene potential, even after dropping the 40% of patients. All right, so if they were to reach their potential and see 96 recall visits per week, that would be roughly 400 recall visits per month. Again, we're not counting perio and new patients. I know I keep saying that, but I want to just hammer that in. 400 recalls a month at 8 recalls a day would be 50 days of hygiene a month. I'll say that again. 400 recall visits a month at 8 patients a day is 50 days of hygiene per month. So if this office is open 17 days a month, you're going to have roughly 3 hygienists, 12 hygiene days a week of just recall. This does not include perio. This does not include new patients. So again, we're probably looking at this office. It needs just 3 hygienists to cover the recall. It probably has 4 full-time hygienists to cover all the hygiene traffic. So let's use that math we just used from, earlier from Oklahoma City. $226 for, bite wing exam and prophy, and $99 half the time for just a prophy. All right, for 400 visits, half being one way, half the other way, that's $65,000 a month if this office hits its potential, or $780,000 a year. So the other way was $21,775 a month, or $261 a year in recall revenue. In this case, again, we're looking at, if this office hits its potential, $65,000 a month, or $780,000 a year. Now, the beautiful thing about this, when you do an implant or you do a crown, there is a high material cost associated with that. You're paying for the crown, you're paying for the implant, right? There is no material. The biggest expense with hygiene is the hygienist. The material, prophy paste is pretty cheap, all right? And digital x-rays cost next to nothing. So the profit margin after the hygiene salary on this is pretty high. And the other beautiful thing about this is if you bring these patients, especially because they're already your patients, and this is, a lot of offices have spoken about this before, spend all kinds of crazy time and money to get new patients, and you should, but they spend little to no effort keeping those patients in the practice. If you were to actually spend some time keeping these people in the practice or getting them back, and it costs you very little to do that, you can build up to hitting your potential. And the profit margin on it is excellent. Plus, it keeps the practice more busy and more active. As a matter of fact, if we went from this office with 31 recalls and 1.5 hygienists, if we include all the hygiene traffic in there per week, to an office doing 96 recalls a week and the resultant additional traffic from that, the perio treatment and the referrals, which we turn into new patients and whatever, you're looking at probably an office, like I said, going from 1.5 to 4 hygienists. There's probably no way one doctor, if this is a solo practice, is going to be able to keep up with all this. They're going to need at least one associate to keep up with that traffic. This is the key to your growth. This is the key to sustained growth. So this is the first thing I would look at if I want to build my hygiene department is evaluate where I am. If I find out my compliance percentage is real low, it's in the 30s, 40s, 50s, even 60s, right? Then I might find that my hygiene department is not near as healthy as I thought it might have been. It means that I'm losing a lot of patients and I need to take action so that I'm not just having patients come in the front door and go out the back. Right? And in this example I gave you of the current hygiene traffic of the potential, this office is losing $500,000 a year in revenue. So, and let me just paint a scenario for you. Let's say that these two examples that I just gave you, this office, where it's at and where it potentially could be at. Say that was 2 separate practices and you were looking to buy them. And they're each doing $1 million. One is doing $261,000 in hygiene and the other is doing $780,000 in hygiene and the doctor is doing the rest. So in one office, the doctor is doing over $700,000 in production and the other office, the doctor is doing $220,000, which I think would be impossible. They would just basically be the hygiene checker and not doing any of the work. If they're only doing $220,000 with that much hygiene activity going on. Which one would you buy for $1 million? I'd buy the practice with a ton of hygiene in it because that means there's a lot of traffic coming into that practice. So this is your growth statistic. This is, it's a key area. This is what builds up recurrent revenue for the practice. And that's the first thing I would do before I start taking actions to build my hygiene department, which I'll get into next week's episode. The specific steps that you want to take is find out exactly where I am. Now, I'm going to add one last little caveat here, which has to do with PPOs. PPOs or HMOs, managed care. And this is kind of important because if you have a heavy amount of PPO or HMO if you have a lot of HMOs in your practice, you're essentially probably charging nothing for hygiene. I just evaluated a practice for a client and we looked at that particular procedure code, 1110 for an adult prophy. And this office has a lot of HMOs and PPOs. And the average fee this doctor was getting for that code was $38. And the funny thing is, where this practice is, the average hygiene salary is over $40. So you're actually losing money bringing patients in. So with the HMOs, forget it. It's a complete waste. I would not build my hygiene department and just cram it full of patients on HMO plans. You're going to end up losing money doing that. But let's say you have a lot of PPOs. So I wanted to take this math I was just giving you and throw it in front of what happens when you have a lot of PPO infiltration in your practice, because this is something you're going to want to consider as you start to build your hygiene department. It kills the profitability, and then you start to see people get into all types of weird, unusual solutions to pick that profitability up. So let's play this out using this example I went with earlier, right? So again, Oklahoma City suburbs, low cost of living, right? And I'm going to use that fee structure. If you had a hygienist working full-time, seeing 8 patients a day, 4 days a week, using those fees I gave you earlier, and half those appointments had exam and bite wings with them and half of them didn't, right? That hygienist at those fees, $226 for a full hygiene appointment and $99 for the prophy only, a hygienist seeing 8 patients a day would be doing about $1,300 a day. That's not bad. That's about $22,100 per month, okay? So now, using that same zip code that I pulled these fees from, I also took a look at, there's a website called feelookup.com. It's the MetLife site. And I wanted to see what the MetLife dental plan charged for these zips. So I wanted to look at how these fees compared. And here's what I found. So again, we're taking Oklahoma City. For a hygiene visit on MetLife, for an exam, they pay $27. For a bite wing, they pay $31, and for a prophy, they pay $55. So remember, the average fee is $58.50, $68.50, and $99, respectively. So for MetLife, you're getting $113 for a full hygiene visit, and normal fees in that area are $226. All right, so now, if you're employing a hygienist in that area, the average hygiene salary, the median salary is about $38.40 an hour. High salary is about $47.80 an hour. So you'll be paying a hygienist $80,000 to $100,000 a year. if they're working on MetLife patients only or a similar PPO, their per diem production, as opposed to $1,300 at normal fees, is $672. It's a 50% write-off. All right? So get this. It's $1,300 if they're working at normal fees. If all they're doing is recalls, they're not doing perio, they're not placing a rest in, they're just doing straight recalls, half with exams and x-rays and half without. At normal fees, they're doing $1,300. On MetLife, they're doing $672 a day. All right? And you're paying them anywhere from $38.40 an hour to $47 an hour. So your hygiene salaries, if you're only seeing PPOs, are usually eating up 57 to 70% of your revenues, whereas if you're seeing patients at normal fees, in this example I give you here, the salaries eat up anywhere from 29 to 37% of revenues, and it leaves a lot extra profit in the practice, and it makes it profitable. So if you're, and I'm sorry again with the numbers, but I thought I kept them pretty simple and easy to follow. And if you have questions, you can always email me at jeffb@mgeonline.com. But the point I'm making is if you're trying to build up your hygiene area, it's very difficult to make it work if you're running at anywhere from 57 to 70% cost on just salaries alone. What will happen is you'll jam lots of patients back into the practice if you have a ton of PPOs, and the salary costs compared to your revenues are just going to be horrible. You're going to find that your payroll costs as a percentage start to go through the roof. So if you have a lot of PPO infiltration, part of what you're going to want to do is probably look at how to move out of some of these plans as you start to build up your hygiene department. Again, I've talked about this before. If you drop PPOs and you do it right, you're going to lose roughly 30%. This is what we found of these patients, which in many cases shows you'll lose some traffic, but you'll lose zero revenue, if that makes sense, right? You'll lose traffic. The example I always use is if you're doing PPO crowns at $800 and your normal fee is $1,400 and you have 3 patients who need a crown and you lose one of them because you dropped, say you do 3 PPO crowns at $800 is $2,400. You drop the PPO instead, and one of those patients leave. Now you have 2 patients left to get a crown and you're charging $1,400 a crown. That's $2,800. So you could do 3 crowns for $2,400 or 2 crowns for $2,800. Do the math. It's also lower material costs and no lab fee. So you have less volume, less work, less labor costs, but the revenues are the same or higher. So it's not as scary as you think it might be. It's just a matter of learning how to do it, how to keep those patients as well as acquire more. We go over this at the MGE New Patient Workshop. I'll put a link on the episode webpage if you want to check it out and get more information. All right. So I know that was a lot. But so the first step here, if you get anything from this episode, is evaluate your hygiene department's health. As I mentioned, you download that spreadsheet, you enter those 3 numbers. It's not very difficult, and you start to get an idea. I'd always love to hear from you guys. If you want to send me some feedback or if you have questions, again, you can always email me at jeffb@mgeonline.com. When we come back for next week's episode, we're going to assume you've determined the health and now you want to take some action. We're going to take a look at what do you do to build up a strong hygiene department. We're going to look at some of the basics as well as some immediate action steps you can take to start making this thing get bigger and retain as well as recover some of the patients who maybe have fallen off the schedule. Anyway, that's all I have for you this week. I do appreciate you guys listening. I hope it helped. And if you want more info about MGE or to find out more about us, you can call us at 800-640-1140, or you can visit us online at mgeonline.com. I will see you at next week's episode where we'll get into some action steps. Have a great week, and I'll see you soon.